Hi.
Hi, can you hear me?
How are you?
I'm testing a new microphone.
Nice.
It's okay? It's okay?
Yes.
Okay. Okay, so like cheers.
That's a big microphone.
Yes.
That's awesome.
How are you all?
Doing good here.
Good.
Great. Okay, so Gabby, everything is okay about the recording and everything?
Yeah, it's recording.
Okay. Okay. Let me just do this. Okay. Brandy, I saw your email
Mhm.
to talk about Ellie's case.
Mhm.
And so I'm going to ask you something, but when we
Sure.
talk about that, okay? So
Absolutely.
hi everyone, thanks for joining us today. We're going to talk about LARC test results interpretation. Please interrupt me and or make a comment in the chat or a question so we can, this is for you. So the objective is that you get some answers and clarification about things. So jump in. I'm going to share my screen. Let me make this presentation. I'm sorry, this is okay. Okay, can you see that?
Yeah.
Great. Excellent. So I've been thinking about something that we always discussed, and so check what I wrote up for LARC test. It says detects the problem before anyone else can. I've been thinking after a lot of conversations with you all about how can we simplify our message and what is the first main big benefit from LARC test. So, because you know that when you say too many things, you can overwhelm your client and confuse them. So we're always trying to make the message simple just to start with, and then we can grow from there. So the LARC test, it's time to look at subclinical stage. And I want to explain that a little bit because you will be, the nature of being a horse person is that you need to interact with veterinarians, even if you don't want to. But specifically being a LARC test technician, you will gradually understand more and more, and I'm going to explain a little bit about that. But what we are doing is actually detecting things early stage, and that is called subclinical. It's before being clinical, and that means before having symptoms. Before the horse is showing symptoms, there is somebody's with the microphone. Maybe we can unmute everybody. Sorry, mute everybody. So subclinical stage, it means it's before the symptoms appear, okay? So we are detecting things before the symptoms appear. LARC test detects what silently affects your horse performance, so you can act before it's too late. We are detecting things early. When you cannot find any symptoms other than poor performance, you need to look for subclinical stages. Again, the same. And we are going to grow on this. So what is the unique value of LARC test? And I think that we all need to make this very clear. And we've been discussing this with you all several times. And I remember one of our conversations with Amy Calhoun. She was going to a big race and we were saying, okay, let's try, what is the main benefit of the LARC test? When you explain LARC test to the client. And we were discussing that in different ways. And I think this is the main benefit that can help us make the message simple and grow from there, because actually it's what differentiates us from anything else, from vets, from exams, from supplements, from other approaches. What makes LARC test unique is that traditional exams can reveal problems this early. We detect things when no one else or nothing else can. And that's the truth. LARC test detects what silently, why we say silently, because we don't have any symptoms yet, as I said before, but poor performance. Actually for us, when the horse is not firing enough and when something is off, that is the first sign, okay? So what silently affects your horse performance, and we can act before it's too late. So we're giving information to the owner to do something about it. And we have the mission of injury prevention, because actually this information is crucial to prevent injuries. We can adjust conditioning, we can start stabilization, we can go to the vet when it's a pain alert, and we need to know that right away, because if we keep pushing, we increase the risk of injury. And if we don't push enough, we increase the risk of injury, okay? So even if you take your horse to the vet, many times you won't get answers. And you know this, you've been there. We all been there. Because the problem is too early to be detected with traditional exams. That's where LARC test comes in. It measures how your horse truly recovers after exercise, revealing hidden issues that silently affect performance. By detecting problems at their earliest stage, you can get answers, clear answers, protect your investment, and keep your horse running safely and consistently. So I wanted to make this very clear before we start with the results explanation and all of that, because first of all, we need to understand what we are doing. And because we've been growing and learning, I think it's time for us to have one message, and one clear and simple message. What is the LARC test? It's a test that can detect things when no one else and nothing else can. I think that's the simple and powerful way of starting the conversation. Then we can explain even more. So answers you won't get with exams yet, okay, because we detected earlier. find what performance exams miss. This is what LARC test does. You can say it in different ways, but this is what we are doing. LARC sees the problem before anyone else can. And that's the value, that's a unique value, that's the benefit, and all the things we can do with that. How we do this? We focus on recovery, exercise recovery. Traditional exams, traditional exercise physiology exams or performance exams, all of them, they focus on measuring things during exercise. They measure the heart rate during exercise, they can measure lactate during exercise, they can measure strides and angles and how the horse moves. They can actually make endoscopies, dynamic endoscopies. They can measure oxygen and all other stuff during exercise, okay? We don't. We focus on recovery. Why? Because exercise recovery is the time when the metabolism is still increased. What is the metabolism? Is all the things happening inside the body, okay? It's like a machine. And all this machine is working at certain speed when the horse is at rest. But when the horse is exercising, everything is increased. It's faster, okay? And everything needs to work properly and at 100%. If not, there is a consequence. That is what we measure. The consequence of not all of the systems being at 100%. And the only time you have to actually detect it is during exercise recovery. And I'm not talking about the 2 or 3 days after the run. I'm talking about 30 minutes within when the run ends, after the effort, okay? So that's why we can detect this early. Because all the body is just being challenged still by the effort. Because all the body, when you ask your horse to move, a workout, a run, or any other move, everything needs to start working faster because it's not the same energy as being at rest. So even if it is a trot, you will have all the systems, they will start working faster, so the horse has more energy. Of course, you will have even more, and you will need even more energy if this is a run or a hard effort, okay? But I'm just saying, from the rest to any movement, you will need a change in this metabolism, even more if it is a run or a hard effort. But when this movement stops, hard or easy, the body needs to go back to rest state. Go back. This go back to rest state is a journey. It's something the body is doing actively. It's not just inertia, right? It's doing it, and we are not using any energy for that. Just the horse body needs to do some stuff to actually have more energy to make the exercise. But then it needs more energy to actually go back to the rest values and to the rest state. So in the two things, during exercise and during exercise recovery, we need energy, and we need all the systems working together and faster. That's why we can detect things during recovery, because the body is not at rest. It's still doing something, okay?
I don't give her a reason.
There is a microphone open. Can
I'll turn it off.
Don't do anything.
Can
and she
you,
is
yeah,
eventually-
can you mute that?
She's eventually
Thanks.
just gonna have to drop it because all she's doing is just waiting to find a time.
So that is why we detect things early stage, because that's the only moment the horse body is doing something like during the exercise. And when everything looks fine, this is the only time we can detect that everything is not fine. Because let's say you have, let's use the bleeding as an example. Let's say you have a small percentage of bleeding inside the lungs, 5%, let's say. And so when your horse is at rest, 5% of the lungs, it's not something that is going to affect the quality of life at rest. He's going to breathe just fine, and he's going to take all the oxygen he needs, and he's going to have all the energy he needs to be at rest. But when he needs to move faster, he needs to work out and to run, he will need 100% of the lungs, not 95%. He will need all of it. And so if we have this only 5% compromised, we're not going to see that at rest. We're going to see it during the run. Because during the run, we need every system to work 100%. And that's why we can detect early stage health issues. During recovery, we need exactly the same. Every system needs to be working at 100%. So when any system is not, we can detect it during recovery. And that's what you do. Every time you are measuring all the values from the horse, okay? So the abnormal recovery is the first sign of the health issue. That's when we generate the health alert. And that's when we communicate to our client, hey, that something is going on, okay? So through recovery, we can establish if this is a health issue or the impact of the exercise if everything is normal and the horse is healthy. Because there are certain ways of going back to rest values for this horse. So if this is going back normally, everything is good, we can measure exercise impact. But if not, there is something going on about the health. And if we keep pushing, when we have these health alerts, oh, we have a misspelling there. When everything, if the recovery is not normal, we're going to generate a health alert to let our client know something is going on. It's a small problem yet, but it's there. If we wait, this can increase and become a bigger problem. So we need to take care of it right away with simple actions. So again, and this is like as a summary of what we've been saying, what is the unique value of the LARC test? The LARC test detects what's affecting your horse performance before anyone else can. We are detecting this through exercise recovery. And now you know that it's the only time all the systems are working faster besides the exercise time. So, because we can detect this early stage health issue, our client can take care of the problem while it's still small, reduce the risk of injuries, and improve performance. How? Again, by measuring exercise recovery within 30 minutes after the run for the heart, muscles, and lungs. That's what you do every time you make a LARC test. You measure that. You're measuring exercise recovery. What the client gets is early detection of pain, bleeding, muscle fatigue, and lung inflammation. And if the horse has no health alerts, we will send the conditioning plan to reduce the risk of injury while they achieve peak performance, because it should be safe and effective to make consistent runs. Stop me, interrupt me, or say anything if you need to, if you want to, okay? So we're going to go into the LARC test results interpretation. So before that, do you have any questions around this? No? Okay, what we are trying to do here is to, all of us, to focus. Is there one? Okay, thanks. To focus on one main benefit from the LARC test, to explain it in a simple way, and then after that we can explain all the things the client can do because we early detect health issues than that no one else can, or any traditional exams can. So LARC test is the only way that you can detect problems early. There is no other way. There is no other tool, actually. If you take the horse to the vet, they won't have answers at this stage. And you always will wonder and guess, is it me or it's something else? And usually when you feel something, something is there. The thing is that you don't have any proof of what is the problem. But I can say that 90% of the times when the owner feels something, something is there. But the owner doesn't have a way of showing what is the problem and what part of the horse body is the problem. Is it pain? Is it bleeding? Is it allergies? Is it just muscle fatigue? Is conditioning? So by early detecting these health issues and conditions that are still small but affecting performance, we are giving such a valuable information for the owner to reduce the risk of injuries by adjusting conditioning or taking care of the health problem, okay? So now, we are going to go to different situations from the results. We will start with saying this, that something that you already know, but the first step when you look at the LARC test results, it's to go to the More button with the light bulb icon. In there, you will see if you have a health issue, a health alert or not. And so you always need to click in there before explaining anything. Because if the horse has a health alert, that is priority. And we cannot focus on the exercise impact because it's influenced by the health condition. So first of all, you click on the More button and you check in the 3 sections for the heart, muscles, and lungs if the horse has a health alert. Even when you see in the lungs the good performance in the middle of the screen, the good performance for the lungs, even when you have that, you can have a bleeding alert. Why? Because it's 2 different things. And we are going to talk about that today with specific case. So step 1, check for health alerts. Step number 2, if the horse has no health alerts, you can focus on the center of the screen. The 2 easy here, 2 easy or good performance, or any other word that you will find on the LARC test results. If the horse has no health alerts, we can focus on the conditioning side, and based on these results, we're going to create a conditioning plan. We've been discussing how to explain the importance of the retesting, and sometimes we know people don't really understand that conditioning, it's a dynamic thing and needs to be adjusted every time because they don't link the concepts of growing in the fitness level and adjusting the conditioning side. But there is something even more important that we do here, and it's injury prevention. And you know you increase the risk of injury every time you overtrain, but also every time you undertrain. Because when you overtrain, you push too much. But when you push not enough, your horse is weak and it's not adapted for the hard effort you are going to ask for. So when you see here everything is easy or too easy, it means you should be pushing for more. Because if not, you're not growing, you're not adapting your horse, and the next hard effort is going to be a high risk of injury moment. So step number 1, check for health alerts. If there is any health alerts, we recommend to check with the vet and to follow the conditioning plan. The conditioning plan, it's going to be a light intensity conditioning plan. I've been asked this a lot. Why? Because when the horse is dealing with a health issue, the energy is going to actually take care of this health issue. It's like when you have a cold or like a flu, you're tired, you just feel that you need to rest, right? Because there's a virus going on. And so the whole body is defending from this virus. It's trying to take care of you. And so you feel like you need to rest and you are tired because the energy of your body is just focusing and going to attack this virus. And you need all your energy to do that. So it's natural that you feel tired and you need to rest when you are not well. And the same happens to your horse. When he's dealing with a health issue, he needs the energy to take care of that. So if we are pushing more, we are in the middle of this priority, which is the health. And so everything that we ask for, it's going to be harder. Because he's not 100%. He's dealing with a health issue, even if you don't see it. But now we know it's there. So we need to honor that. And that's why we make a light intensity conditioning plan, because this horse is an athlete, it's an active conditioning, so he needs to move. We don't believe for athletes in the stall rest or do nothing. And we don't want to lose any fitness level that we could possibly have built so far. So the horse needs to move, but not so much, not so hard, because he's dealing with a health issue. So recommendation is check with the vet and follow the conditioning plan. If the horse has no health alerts, everything is good, focus on following the conditioning plan, which is customized for this horse and these values, so you can make your horse stronger every time and reduce the risk of injuries for the next run. It's safety first, okay? Safety first. We are taking care of these horses. That is our priority. A comment here about the conditioning plan is, you know, it's not mandatory, right? So we always send the conditioning plan. It's part of the offer. It's part of the service. So we always deliver the conditioning plan, but if they don't want to follow that, that's okay. Just check with the LARC test again, create your own conditioning plan or make your own moves, but check with the LARC test at least once a month to see if your horse is doing well, if he is dealing with some health issues, or if he's being adapted for the next effort. And so you are in a safe situation, okay? Any questions so far? We are all very, very quiet today. We're very serious today. No, it shouldn't be like that. I'm just trying to be very clear about what we want to say. But let's remind ourselves that we are taking care of horses. We're doing something really good here. And it's good that we have a simple message to help us grow. Because when people don't understand, they don't do anything. When it's too complicated, it's like, okay, yeah, no, it's not for me because I don't get it, okay? That's why we are highlighting the importance of the simple message and what we're doing. So a comment about this, that when the horse has no health alerts, you will see all of these different possibilities of the intensity of the workout, okay? Kaylin, thank you. I'm reading your message. Yes, exactly. When we say too many things, we confuse them. And when we confuse them, we lose them. That is what's happening. So sometimes what we are trying to be really responsible about it is the message, because sometimes we hear like, oh, there is a lack of interest. And sometimes, so before actually taking that as a truth, we need to go back and see, okay, what are we doing wrong, or how can we improve what we are saying? So we check if there is actually a lack of interest or people just don't get it because it seems like too complicated, you know? And that happens with an innovation when you have so many good things to say. It has been a growing journey, and I think we are in an exciting place right now to actually be very clear about what we do, how we can help them. So again here, when horse has no health alerts, you can see these different intensities on the center of the screen. Is the exercise impact on the horse. And again, this is very important. It depends on the horse, not on the workout, not on the exercise. If you're taking notes, please write that down, because it's one of the important things we need to understand and actually builds your criteria around it. It's not about the workout or the exercise or the run or the speed. It's about the horse. It's about the horse adaptation of that effort. If the horse has no fitness level, and let's make this very clear, like black and white, so it's very easy to understand. If the horse has no fitness level, a very easy workout will be hard for him because he's not adapted, okay? And if we have a really fit horse and he's going for a run, it might be easy, it might be great, because he's adapted to that effort. And so the effort is not hard for him. He is adapted. And that is actually the foundation of how you can grow, how your horse can grow, and how we can prevent injuries. Because when we adapt our horses, we are actually taking care of them. We adapt them for the effort we are going to ask them for on the weekends or races or rodeos or whatever is that. So when the too easy, almost great, hard and too hard, it depends on the horse adaptation. So when you LARC test the horse and you see the too easy and easy in the center of the screen, it means you can ask for more because he is adapted. It was easy for him. And actually you need to ask for more, because if not, you are not adapting him for the next level. When it's almost great and great, it means he is adapting. He is in that process and he's doing well. So you can keep the same intensity or you can ask for more too. It's safe to ask for more at this stage, okay? But then when you have a hard or too hard, it means he's not adapted to that yet. And the objective is to make him or her fit. So you need to go back and keep working on that. So the next effort, the next time you LARC test the horse, it's easy or great with the same intensity. So we go back and we keep working on that. Questions around that? Okay. And then we have the lung intensity levels, and we have 3 of them. Thank you, Kaylin. Super simple, she says. You can see 3 different answers or results on the center of the screen. It could be good performance, could be improved, or need treatment. And this is related to more the inflammation, health alert. That's why I told you before that even with a good performance in the center of the screen, you can have a health alert of bleeding. So you always check the label icon, more button, all the time, every time. When it's good performance, if the horse has no health alert, everything is good. Sometimes you can have a good performance and a bleeding alert. And that would be, again, the situation number one when you need to recommend to check with the vet. When we have could be improved or need treatment, it's just two different stages of lung inflammation. The one thing you need to know is that there is a lung inflammation alert, and we need, again, to check with the vet. But I'm just showing you this to give you information of the center of the screen, but you don't need to worry about this actually, because when you have this could be improved or need treatment in the center of the screen, you will also have the lung inflammation alert in the more bottom. So you just need to go back. What I told you before is what is right. First step, check the health alerts. Second step, if there is no health alerts, we can focus on the center of the screen, okay? So you don't need to worry about this actually, because if you have a could be improved or a need treatment here, you will also have a lung inflammation health alert inside the more button. Let me see if we have, when it's good performance and bleeding alert, would it be considered early stage? Yes, always. Always, we detect early stage. We don't detect anything else. You know why? Because when it's early stage, you don't have any symptoms. Then the next step, if any problem grows, any problem will start showing symptoms. And when you have symptoms, you already know what is the problem. For example, if you have bleeding on the nose, you know it's bleeding. If you have a cough, it's a respiratory issue. You know it's a respiratory issue. If you see your horse lame, it's a lameness issue, right? The muscle fatigue, it's a little bit tricky. You won't see lame when they are fatigued. But what I'm saying is, when you see a symptom, you already have the clue there. You don't need the LARC test. You already you are seeing the problem, okay? The LARC test detects before that, before you have that stage of the problem. And that's why it's so important, because you will have the pain alert before you see your horse lame, before you go for the next run and actually get the injury. That's why it's important. Chelsea says, I had a client who had good performance and the conditioning program was easier than what the client had already been doing. How should I respond to that? So if it was easier, it could be two things with a good performance. Whether he also had a bleeding alert, which we need to decrease the intensity because there is a health condition, or she had a hard effort in some of the results. So when you have a hard effort, let's go back. When you have a hard effort, I can go back here. You need to step back and keep working on that. Let me see, no health alerts, okay. If you want, we can check the horse, but the other option would be if she had a heart for any of the systems. I have Adele. I tested a horse in July who had good and great performance and no alerts. Owner had tested because he felt the mare was off. He started following the conditioning plan and a month later still feels the mare is off. And I agree, looks like she's dropping when he lopes. He's going to the vet with her again. Any ideas why the LARC test didn't show anything? Yes, it could be if he was using any drugs at the time, or the effort was not challenging enough. So if you test, and this is a good point, thank you for bringing this question. If you test an effort that is not challenging for the horse, we are not going to see any health alert because you don't need all the systems to work perfectly because the horse is adapted to that. It's like making a trot. You won't have any health alert for a trot because pretty much all horses are adapted to a trot. And so the amount of energy they need to create is something easy for them. And the amount of energy they need to create to go back to rest values, it's easy for them. So they're not, if they can use the 95% of the lungs, if we go back to that example. Okay, great. That is something we have discussed and it's important too. When you have the drugs and it's not, the health alerts can be hidden because of the drugs, okay? So right now we're going to start with a couple of case situations, more specific. I'm not, because I'm making the presentation, I'm not seeing all the names, but Emma, if you are here, and if you want to jump in to say something about Miss Perry, is Emma here?
Well, I think she's not.
Okay. Okay, so no problem. So this lady, Emma tested her horse August 16th. And this is the result. As you see, these are the values. A little bit bigger so we can see everything. Can you see that there is the 16.6 for the first lactate and then 17.5 for the second lactate? This is the recovery, right? So we are measuring how values go back to rest values, how they go down, because they are increased during exercise and they're supposed to go down during exercise recovery to almost the rest values. So if you remember this graphic on the bottom of the screen right now, where we are measuring the exercise recovery, we can detect abnormalities. And when the lactate is going up on the second measurement, it's abnormal. That is an abnormality. And that it's correlated with bleeding. So every time you have the lactate higher than the first one, not always, there are exceptions and no need for you to know that, but 80% of the times, let's say, when the second lactate is higher than the first one, you will have a bleeding alert. And this lady received the conditioning plan. It was lighter because what you already know, the horse is dealing with a bleeding issue, and so I cannot push him. I cannot ask him for more right now. So general recommendation, check with your vet, start nebulizations, and follow the conditioning plan. Okay, so far so good, but she didn't want to. And she was, it was not skeptical about the conditioning. It was that she really wanted to understand why the conditioning was light. And so we jump in a call with Emma and Miss Perry's owner, And so I start explaining about all the things you already know and why we need to make this conditioning plan lighter. And then she started telling me something that I thought was really interesting. She told me that Miss Perry had allergies, like forever, lung allergies. And she was making nebulizations like 3 days before the race. So she really wanted to understand why we have the bleeding alert if she was making nebulizations and they are doing great because we don't have any lung inflammation alert. And so I started explaining something that I would like you to know. So I said, okay, this is interesting. Look at what you're telling me. You're telling me, okay, I'm making nebulizations and I don't have a lung inflammation alert. And that was correct. She didn't have a lung inflammation alert. So the nebulizations were actually being effective for the lung inflammation, part of the horse situation or tendency, which was to have allergies all the time. And so nebulizations are being effective because what you are doing with the nebulizations, it's just decreasing the inflammation. You are giving dex and you are making this inflammation go down and just decrease the inflammation. And so you can see, because of these LARC test results, that was effective 3 days before the race. And it was effective because she didn't have any lung inflammation alert. But she couldn't get rid of the bleeding with the nebulizations. And why is that? And how we understand this in a better way, since we always recommend nebulizations, and we also know that every time you have a bleeding episode, you also have a little bit of inflammation because it's just connected everything. So she couldn't get rid of the bleeding alert because the bleeding alert, it's related to this lactate value, as I told you before. And this lactate value is not connected to any inflammation. It's connected to the horse adaptation of the workout. So let me explain a little more about this. The bleeding is caused by a lot of things, but if we need to focus on one thing, the main thing that it's causing the bleeding inside the lungs, it's the pressure inside the lungs. And the harder the effort, the higher the pressure inside the lungs, the higher the risk of bleeding, right? So a hard effort, high pressure inside the lungs, high risk of bleeding. How can we decrease this risk of bleeding, which is the most frequently asked question? How can we prevent the next episode of bleeding? How can we manage bleeders? If we go back, thinking about the pressure inside the lungs, trying to decrease the pressure inside the lungs, the only way we can do it, because there is no other thing you can, is to adapt the horse every time a little more, so that effort is not that hard. If you can make that this effort is not hard for him, you are going to actually create the situation where the pressure inside the lungs is not that high. because he is adapted to it. And the only way you can do that is through conditioning. That's the only thing you can control, conditioning. And through adjusting conditioning, you can actually improve the situation that is causing the bleeding, which is the high pressure inside the lungs. Questions around this? I'm going to address your question, Amanda. Just give me a second to finish with this explanation. Any questions regarding this bleeding alert? How to prevent the next episode? Lung inflammation alert?
Well, I'll jump in, because I think that it's a question that a lot of people have. Maybe they just don't know how to exactly word it. But when you get your bleed risk alerts and you recommend them to follow up with a vet, they do a BAL and they get, or a scope of some sort, and they do, like the horse did bleed, and now we're on antibiotics and, you know, possible rest and things like that. And the conditioning program, we know, is written based on those health alerts, and then staying in communication between the tech and the vet, and like what the follow-up is on the horse, I think is pretty important for you to know, Dr. Chula. But how do we progress forward with them, as far as if the vet's like, we'll always run them on Lasix? And so, like, what would be the steps there if somebody has questions based on conditioning program, and the vet is recommending to run the horse on Lasix, but say somebody doesn't always want to run the horse on Lasix, or wants to see if they can improve and eventually not run on Lasix. And maybe that's just for a later date to really go into depth, but what would your recommendations be for that client?
Okay, so you have two options. The client that is going to the vet and actually confirming the bleeding, or the one that is not going to the vet, right?
Correct.
So for the one that is not going to the vet, we recommend to make nebulizations. I'm actually always sharing the protocol that for me it's successful. And so what we recommend is following the conditioning plan, making this nebulization protocol, and after 2 weeks, retest to see if everything is clear up. That would be the next step. First of all, because if you have the health alert clear up, you can keep pushing. And again, if you don't push enough, still you have risk of bleeding or any injury. So that would be the recommendation. If you have the client that is going to the vet and they are actually confirming the bleeding, and they are under the antibiotic protocol, they need to follow the conditioning plan, which is light enough to be safe for them, even with the antibiotics. And then when they finish the antibiotics and all the treatment that the vet is recommended, LARC test again. So we know what to do next. Is that what
Oh, yeah.
you, okay, excellent.
Absolutely.
Yeah. No, I know you are just throwing
Mm-hmm.
frequently asked questions and knowing what to do.
Yeah,
So that's
absolutely.
great.
Perfect.
Anybody else has questions regarding this bleeding episode or explanation? It's clear, it's not clear, it's...
Dr. Chula, this is Lindsay.
Yeah.
So this does fall into the bleeding realm because I do have clients. They will follow the conditioning protocol and stuff, which is fine, and they work very closely with their vet, as do I.
Yeah.
recommended Lasix. That is the main recommendation up here. And
Yeah.
so what happens is they become basically afraid to run that horse without Lasix. They will follow the conditioning, or they will try to improve their conditioning the best as possible, but they will not run that horse without Lasix. So what I have done is I have suggested certain specific arenas that are moderately safe to maybe run that horse without Lasix to get more of an accurate test result for the next round. But that's not always something. So are we just safe to say that as long as they continue their Lasix, at least we can see if their Lasix is covering that horse and doing its job for bleeding alerts?
Yes. So one concept I would like you to have in mind is that even if they run on Lasix, we need to improve the horse adaptation.
Right.
Okay. So that is like, that is the main thing. Like, okay, you run on Lasix, but you need to keep doing this work because that is how you create safety for your horse. Because the bleeding is something that it's every time you have an episode, you have more risk of having a next episode, right? It's increasing the chances for the next episode because the lung is all weak and all these new vessels are weak and all the inflammation. And so every time you have a bleeding episode, you have more chances of having the next one. So when you run on Lasix, sometimes if you like continue with these dynamics, you will need more and more doses. And that is not beneficial at all for the horse because you are dehydrating your horse every time you use Lasix. So what I would have in mind is, okay, you run on Lasix, but you just keep doing the work. Okay, just keep improving the fitness level of your horse. Maybe eventually you don't need the Lasix. Maybe eventually you can try to use less doses. I like your idea about going to a safer arena or someplace that you can test without the drugs to have like a real and results. I like that very much. So I agree with you. If you could do that, that would be ideal. But if you cannot do that, because not everybody have that chance of doing that, what I would say, because I understand the fear of running without Lasix when you start using it. So I would say, as we always say here, which is, okay, let's LARC test the same, because what we can tell you is that if the Lasix was not enough and you are still having a bleeding issue, even with the Lasix, you know? So I agree with you. Just explain to people that we need to get our horses stronger. And so even though they are running on Lasix, just keep doing the work, okay?
Thank you.
Thank you. What are your thoughts on flare strips helping decrease pressure in the lungs? Okay, that's a good question. Let me tell you something. I like flare strips because it's actually what is decreasing, it's the resistance of the whole nose and nasal cavity for the air. So you can capture more oxygen from the air. But if you have an inflammation inside the lungs, in the lower airways, the flare strip is not going to compensate that. Okay, just to have that in mind. I like that a lot, but it's not preventing the next episode. You know what I mean? So we still need to work on that. Actually, the flare strip are very used in the human athletes. And let's say they don't have any problem in the lungs and they have really clean lungs. they will use it just to capture more oxygen, and that it's scientifically proved that it's like that. So they will have more energy, okay? So I like it, but it's not because you use that you will prevent the next episode. So I will read Amanda's text. I missed part of the call, so I apologize if this was discussed already, but I would like to know how to present the results to a customer when you get a heart for the heart, not on pain meds, and owner is carrying on maintenance with no concern of pain lameness, and effort was good for the horse. But horse was anxious during second part of the testing. I did disclose that this could be a result of her anxiousness, and that if we test her again, we could need to consider a better environment for her to be more settled, to get more accurate results. I just also hate to assume there is no pain or vice versa, being that it just could have been her nervousness. I feel it's a little of a letdown to the client when they pay and arrange to test and don't feel the confidence or accuracy is there when we are having to make some guesses assumptions. Okay, so good question. First of all, there is something about a test which is a range of it's called sensitivity, which when you decide this for a test is what you are deciding how sensitive is going to be the test to detect specific things, okay? The reason I'm saying this, it's because the sensitivity of the LARC test for the pain, it's very accurate, and it's excluding the majority of nervousness or anxiety cases. Because when you have a nervous horse or anxious horse, the second heart rate could be high, but not that high as for the pain, okay? But good question. This is biology. These are horses, and it's not 2 + 2, it's 4 all the time, okay? So, and I know environment can be tricky sometimes because the horse is moving, a lot going on around us and all of that. But maybe, let's just say, if you can, depending on where you are at that location, you can go to a stall. If you are at the event, you borrow a stall, or you can go outside just for the second measurement in some place that it's a little bit more quiet for the horse. You can do that. Another thing I need to remind us is the second heart rate. When you measure the second heart rate, you always remember to wait the 10 seconds before you start counting for the beeps, okay? Because that is a reflex, and a normal reflex from the horse, and it's going to mess with your values, okay? So you always listen with a stethoscope, wait 10 seconds, and then you start counting. So I would say maybe if you want, we can check that horse and those values specifically, but it was a heart but no pain alert, or it was a heart with a pain alert. Because that would be the limit of the nervous anxiety versus the pain thing. I don't know if you remember, if you have a pain alert or it was just hard. So depending on that, we can explain a little more. If it was an anxiety issue, we can go to a different place to see if we can calm down the horse. But if it is inside the pain alert, I would prefer to recommend to check with the vet, even if that is just nervousness. Because if there was a real pain alert, it's better than we address that, instead of assuming that it was anxiety. The more button said check pain or soreness. So it was a pain alert. Yeah. Okay, that it's a way of saying, it's good that you brought up this, Amanda. That is a way of saying, because the app is public, and it's like we cannot say that we diagnose things, because we are not diagnosing things. We are just giving information. So the way we are allowed to say this is the reasons because of the heart rate going up. It could be pain, it could be nervousness, and it could be weather conditions. But every time you have this notification on the more button, it's the pain alert. Okay? So you say, hey, you have a pain alert, check with the vet. Okay? Is that clear? So the way you read it, the wording is, this could be pain, weather, or anxiety, but it's the way we should word it because of legal regulations. Because if not, we've been diagnosing. We cannot say, hey, it's pain, you know? So we need to say, this could be because of the list of things that could be causing this. But actually, for us and our recommendation to the client, this is a pain alert. And you need to check with the vet. Okay? It's good that you brought that up. Okay. So on the CP, it actually says pain early alert. Exactly. Yes. So yeah, you had a pain alert. It's the word, I think it may be the wording that it was confusing, but it's because legal regulations. When we say something about our test, we need to really be specific about the wording. So nobody can tell, hey, you told me it's pain and it's not, or you are diagnosing and you know, so all these legal things, but it's a pain alert. Okay, so here. Is there a way the app and the CP could be more consistent so the client doesn't hear one thing? Yeah, we're working on that, because we had the app first, and then we started with the conditioning plans later. So that's why it's consistent, because you have the pain alert and the conditioning plan says pain alert. And when you have the good performance and the bleeding, actually the conditioning plan that you receive, it says why you can see good performance even with a bleeding alert. It's explained there. But we know what you're saying about like being equal, right? Like the same, actually. So we don't have to explain any further. And we are doing that. We're updating all the software. Okay, Kaylin is saying, I love seeing the explanations you give on the CPs for the client. I think, and Amanda says, I think this is where a lot of gray area it's open for the interpretation of the technician. Yes, and that's why we started with this masterclass, so you have a clear understanding of what you need to recommend. If we go to a different case, this is a horse with no health alerts, but something that I think it's interesting for you to see, because it was a question from the client and the technician. And as you can see, and I put it here in a bigger size, the results at the bottom are the first one. You can see here it was May 23rd, and then May, June, August. From the bottom up, it's the first test was May, almost right, then hard, June, and then August. The question was something about, hey, why we are having a hard effort now after 3 months and all of that. So what I would like you to see here, oh, no, I just want to show you something. I don't know why was that, okay. So here, can you see these? Almost great was first one, then hard, and then hard again. But what I would like you to see is the values of the lactate, okay? This one, and this one. Can you see that the first one was 10 to 6, second one 13 to 12, last one 18 to 15. So this horse is improving. Every time it's a little faster. This lactate being higher, it means this horse is growing more fast twitch muscles. So the work we are doing, it's being effective and it's actually improving. The thing is that every time we improve and he is adapted for more, we are asking for more. And so the last challenge, the last exercise, the last run, it was really hard compared with the first one, okay? I'm just wanted to clarify this because sometimes you only see the almost great or hard. And so you say, oh, but this is hard. And 2 months ago, it was almost great. So what's happening, right? But I wanted to show you the lactate value so you can see that we are improving. And it's not only the hard for the grade or the too easy. I actually check all the values before sending the conditioning plan. And you can actually see that the heart rate is also for the harder effort. It was even higher, okay? The 102 beats per minute, it was harder. So just show you a little bit more deeper things inside the test so you understand more deeply this. I would like to Brandy to explain Ellie's case, not this one. I have it here, wait, here. So these are the LARC test results from Brandy's horse, Ellie. You can see from April 2024 to February 2025. Would you like to share something, Brandy,
Sure.
about Ellie's, and then I can point out the values so we know, we understand a little bit deeper.
Yep. Yeah, absolutely. So this is originally my daughter's horse, but became my main mount when my main horse kind of went down with an injury. So and we haven't owned her very long, so still getting to know the horse by the time like she came to really challenge with me. And I wanted to LARC test her, and I wanted to get her in the best shape that we possibly could going forward, because of the challenging season that I had ahead of me. she was never ever like 100%. You could tell she wasn't always given her full effort with my daughter, whether that was lack of her asking or just, you know, getting to know a new horse. But she would constantly blow that third barrel pretty wide. And we went to, I mean, lots and lots of lamenesses, lots of that injections, follow-ups, stuff like that, but something still just wasn't right. Started LARC testing her, and we got a bleeding risk alert. So immediately, that was in April, and so immediately took her in, and we did a BAL on her. And you know, you'll see the 2 Aprils like right there pretty close together, because we wanted to make sure that, you know, I wanted to check myself and make sure that those results are accurate. And so we ran her again and got pretty much the same results. And so we did a BAL, and that came back as pretty non-diagnostic. There was definitely no bleeds, nothing like that. There was no real lung inflammation in the cells. And that led us to, based on her history, and talking with Dr. Tula about things that might affect her, like EPM, which does affect the muscles a good bit, we went straight to doing a neurologic exam and EPM testing, and she was positive for EPM. And then you will see the next test, we scaled her back as far as conditioning. She still stayed on the conditioning, like she was never out of work. We did our conditioning plan. Treated her for the first month with EPM medications, and you see that her results improved. Like, as far as like, it wasn't hard for her. Like, we're back to like a baseline, like it's a good effort. Now we can build up from here. And she stayed on treatment for 2 months, like EPM treatment. And the personally feeling her and riding her, the results from that treatment plus the conditioning plan was astounding. The improvements that she made was really, really, really impressive to me. And then we stayed pretty good for a long time. And then you can see in January, we haven't been off the conditioning program or anything. We kind of went back to maybe something's up. Maybe it's too hard. Maybe we need to scale back. Well, she had an EPM flare. And so January, I think it was January, we had like the first effort that I was a little concerned about, and scaled back a little bit. And then February was okay. And it was right after that test in February that she had a fall on the trailer. We're not really sure how that happened. I mean, honestly, it wasn't due to driving or any of the normal things. And it turns out that she was very, very neurologic again. So we have since retired her. She's been treated. She stays in, I mean, she still gets walked on a regular basis and stuff like that to improve her condition. But I thought it was fascinating that, to me, and in my interpretation, and Dr. Tula, you can tell me, it looks like for her particular issue, and it really helped point out that we might have something going on again based on the previous things that we had seen with her test. And I think it highlights the importance of continual testing and those early health alerts that you get. It was pretty eye-opening for me.
Yeah, and I like to use Ellie's case and what you are sharing with all of us to actually open our minds to other things. But first of all, what you're saying, if you look at the lactate values from the bottom going up, you can see the first one, it was too easy. I don't remember what that
one was a test. We were just doing like a test with the meter and all that good stuff, just to kind of make sure that everything was calibrated and going well.
And going well. Then you can see the second lactate, like 6 to 11, and then 6 to 10. Those are the 2 tests Brandy was telling you about. The bleeding alert, actually what we are showing here is the bleeding alert, but because Brandy worked with her vet, and based on the horse history, they can actually realize that this could be EPM, so they went for it, they confirmed that, and they started with the treatment, and then you can see that there is no more second lactate being higher than the first one, meaning the treatment is being effective. So, and I need to tell you that this, when you start using LARC test and when your vet starts using LARC test, we could see a lot of things. I always tell the same thing because I think it's amazing. Dr. Whitaker from Brazos Valley Equine Hospitals, who is one of the first one that started working with us like 7 years ago. So he diagnosed anhidrosis and arrhythmia based on the LARC test results. So we are giving valuable information to take care of these horses. So sometimes the bleeding alert, okay, it's not confirmed, but something else could be affecting the horse, okay? We are giving valuable information. It's not about the test. We are actually taking values from the horse, and we always say we translate what the horse is telling us. We speak for the horse. So something is going on, and we need to address this and take care of this because something is happening. It's based on the physiology of the horse. It's not just an invention like, you know, I don't know. It's based on the horse physiology. So if it's there, something is going on, okay? And it doesn't matter if LARC test is saying pain. Sometimes the pain alert, it could be a lameness issue. Sometimes it was a bleeding, a very bad bleeding. Sometimes it could be EPM too. So we need to understand that these health alerts, yes, they have a name, but something is going on. So let's use them and let's work with the vet so they can confirm a good diagnosis and move forward. Any questions so far? Or any other case you would like to discuss? Robin says, going into a vet appointment for my dog. Okay, I need to. Okay. Okay, so we made this presentation for you and to have this conversation, to start working on a simple message, something clear, something that you have maybe in a more structured way, knowing that these are horses, are biology, but we are offering people some certainty. Certainty for these times of not knowing what's going on, but they need to know if it's only in their minds or something is happening. That is the first answer we are giving them. Something is happening or it's just you, right? This is the first question they make. And we can help them with this, and we can help their horses with all the information. So if you, Amanda, can you explain how distance and duration values are factored into the results? If following the cheat sheets, the distance and duration is based on the size of the pattern, which I think makes most sense, as there is obviously a difference in running, yes, the 30 seconds and 18 seconds pattern. But in additional training, we will also say that, yes, as a follow-up to that, with multiple tech testing, retesting, what values are all techs using? Okay, so one thing that I always explain about the time and distance, it's not affecting the LARC test results itself, but it's helping in the analysis when you have more than one test. and it's pointing out this was a run or not a run. It was just a hard workout or a run, because it's very different, the challenge. So we've been using the 0.04 just to point out that it was a run, okay? When we use that, we know it was a run, and so we can analyze the values knowing that it was a run, but the cheat sheet helps you make this more accurately, and it's going to show you the speed of the workout or the run. And so it's always better to make it more accurate. And if you want to use the cheat sheet, that's great. And then it's going to be better for analyzing when you have multiple tests. But if you mistake for any reason in entering those data, the time and distance, it will be affecting the speed, but it's not affecting the LARC test results, okay? Okay. Is this something else that should be used consistently across all texts for trending sake? Yeah, you mean the cheat sheet? I think so. Yeah. Yeah, that way we will have the same data points. Yes, exactly. Exactly. Yeah, that's why Gru created that cheat sheet, and I think it's very helpful for that. Yeah, I agree. So this was the first conversation about the LARC test results. If you are watching the replay or after this, you just remember something, some question, or if you have any new case and you want to, before explaining a little more to your client or anything like that, you can also share that in the Facebook group. We are all in there. And so we can grow this together, because I understand there is a lot of different situations. For me, it's good that you have the basics first, and then when you have a singular case, something that is different, something that you are not quite sure of how to explain it, just throw it on the Facebook group and we will discuss it and you will have the final answer. And that's the only way we can grow. It's because it's just, we are not talking about 10 courses or 10 different cases. And this is, again, biology, and with all these factors affecting every horse in a different way. So every case will be different. So don't try to have all the answers right away. But what we would like you to have is the basics answers. So how to start, what is the baseline to recommend, and then, okay, this, I'm not quite sure about this, or this is maybe different from what I've been dealing with, or this case different, or the owner is just asking me for this and I don't know how to answer or think about it. Draw it on the Facebook group and we will chat about it, okay? The main thing is that you feel confident about what you are doing, why you are doing it, and what is the first answer to your client. Okay? I think we are good so far. Brandy, Gabby, Sandy, anything else?
I think we're good.
Yeah, at this, I think we're good. Thank you. I mean, we have a lot of people on here. It was awesome. Thank you to everyone who joined in, and for the questions, and it's all good. All the learning is always good.
I I was cut, or I don't know what happened. Crystal Fraser is asking, will be able to print this material? Yes, for sure. Yes, yes, for sure. Thank you all for being here. Thank you. See you next time. Yeah, talk to you soon. Have a great day.
Thank you.
Thank you. Bye-bye.
Bye.